to, and I do record whoever stays on. I'm letting you know now while we're early on the podcast, right? I record whoever are the top 3 listeners. I write them in the comment section, the caption section of the podcast that I post to Spotify, YouTube, etc. Matt in, Simona joined, Kimberly joined, Dreamgirl150 joined, Diana Green joined, Margaret Rodman joined, Brenda joined. What's up, Brenda? Vadim asked, how long do you have left in the hospitals? Oh, great question. I got about 10 months left. June 2025, I graduate. Just about done with August. What's the date in August? It's the 19th of August right now, 2024. So the rest of August, September, October, November, December, January, February, March, April, May, June. But May, because it's June when I graduate. So what is that? What do we got here? 9. Wow. Already, let's just round up, call it 10 months. Yeah, so we're getting there. We're getting there. How we doing? How we doing, everyone? Thanks. Vadim 102572 said, great, good luck. I appreciate that, friend. Thanks a lot for that. What's going on? Someone usually asks me about my watch on this. This is a watch. This is a Jack Mason Hydro Timer. I thought I'd point that out here. It's a diver's watch. I think they discontinued this color of it, but when you buy it, you could get 2 different bands. So I usually have the rubber band, and then I got this one second. I really like the 3-link band. Pretty sweet. It's pretty sweet. John Hall. So much training to spend a career taking out wisdom teeth. Well, John Hall, we don't make the rules, do we? But I'm going to be doing a lot more than just wisdom teeth. So I don't want it to be like, general dentists can take out wisdom teeth. Sometimes I would personally, I would spend any wisdom tooth. If I was a general dentist, I would send anything to an oral surgeon in, hindsight, because now being in residency, we get all those complications that come to us. General dentists, periodontists taking out wisdom teeth that maybe don't know the best way to prevent complications, mitigate infections that sometimes happen. Sometimes it happens taking out a bad wisdom tooth, or any tooth for that matter, and then it spreads to the sublingual, submandibular spaces, the pterygomandibular spaces posteriorly, then it starts to compromise the airway. Man, sometimes it could spread upwards towards the skull base, way back in there. Yeah, scary stuff. We've seen it all. A lot of stuff. Yusef joined. What's up, Yusef? Rohit joined. John Hall. That's where the money is. Yeah, but, you can't do it for the money. Obviously, you want to make a living, and healthcare is changing a lot. Many doctors are making the same than they made in the 90s, but, money doesn't go as far as it did in the 90s. So, I don't know, that's one thing. That's another conversation. We could talk about that for days. John Hall, I agree. I avoid wisdom teeth if possible. Dr. Hall, my apologies on addressing you incorrectly the first time around. But John Hall said, keep up the good work, man. Thanks, Dr. Hall. I appreciate that. And likewise, and you too. Yeah, avoiding wisdom teeth, broken down teeth, whatever it may be. Yeah, and then replacing it with an implant, right? Yusef, why didn't you take the MD degree? Well, if you can do the same oral surgery after residency, whether you get the MD or not, it's an extra 2 years. Most residency programs, you have to pay for that MD degree for those 2 years, and you don't even need it to do all of oral surgery. Now, if you want to go into cancer resections, taking out cancer of the head and neck, then you want to do a head and neck fellowship. That's a 2-year extra training after that. But, that's not something I want to do, right? I'm going to be doing it in residency, and after that, I'm not planning on doing that so much further. So, you could go into plastic surgery fellowships, cosmetics, tummy tucks, breast implants. You could do that after oral surgery. I'm not interested in doing that. And that's really the only thing that the MD degree can be beneficial with. You see what I'm saying? So let's get to some more questions. But yeah, why would I get the MD if I'm not going to use it? I respect it. I get it. But why would I get something I'm not going to use? I don't know. We live once, right? I want to spend time doing what I want to do. Erickson, Anto, hola, Brendan. What's up, Erickson? Jocelyn, hi from Oregon. What's up, Jocelyn? Hi from Oregon. Hi from New York over here. What's up, Oregon? John Hall, I rely on my OMFS. And then we rely on all dentists, We need to come together as a profession and start making a difference and change things for the better of this career path, because this is not the career path I started. I'm still in residency, and this is not what I got got started onto, right? Between the insurance issues, between the corporatization, and then the ideal job that most dentists wanted going into dental school, residency, what have you, aren't as available or don't exist in some areas. So we need to make that where, now I'm not saying that we can't have corporate jobs, but we can't completely follow direction of medicine and only have corporate, and then you can't create the job that you want even as a doctor. That's a problem. Being a doctor is a stressful job in most specialties and areas, right? Be it medicine, surgery, dentistry, and whatnot. So you need to be able to live the life you want to live. And a lot of that is your work environment, the work culture and stuff. And you can't control that if it's not your work environment. So amped up, shawty. My boyfriend is a PGY2 at a 6-year. I wish he was in the 4-year. LOL. LOL is right. LOL is right. Yeah, I know. I completely hear you. And by the way, congrats, PGY2. It is amped up, shawty. Let me know. Let me know what program that. I might know them. They might know me. Let them know I said hello if you do it, and good luck. PGY 2 years, a transitioning year. Well, no, he'll be in the medical school now, right? So, yeah, let me know. Johnny said, do you respect the work ENT does with jaw fractures? Of course. I mean, of course we respect that. The one thing I would say is that, remember, ENT aren't trained on occlusion. They're not trained on teeth. They are not. And we get called in all the time to remove those teeth, and that's fine. But when you fix, say, a mandible fracture, you got to make sure that the teeth, the occlusion is in line, that the occlusion comes together accordingly, appropriately. And sometimes, many fractures, you can't get perfect occlusion, right? You get a jaw fracture, the bone underneath, the foundation is broken. But that being said, it shouldn't be a requirement to get orthodontics after your jaw gets fractured necessarily. Do you see what I'm saying, Johnny? But, it can go both ways. It also depends on the type of fracture. Not every fracture is the same. You got comminuted fractures. You got compound fractures. You got most mandible fractures are compound. Unless they're non-displaced and there's nothing there and they don't involve the PDL, then maybe not. I could go on with this for days. John Hall, Dr. Hall says OMFSs are like the Coast Guard. You can depend on them. Yes, I wish it wasn't only for being dependent on, because I'm seeing a lot of implants go to other places. You know what I mean? So that's an issue I foresee. Jefferson S. Raskin, hey, Doc, I couldn't agree more. Dentistry is administratively strangled. Yeah, why? Why does it have to be like that? We got to get back to the glory days of dentistry, right? There's so many doctors that chose dentistry because it's not medicine. You have a better lifestyle. You got a better quality of life. And now we're just following the trajectory that medicine took. And you know what? No one's really happy in medicine. Most doctors are not. So that's a problem. We should be promoting and building these professions and career paths into a brighter direction, not a darker direction. You know what I mean? Empathy landscaping, nice. Number one, just got the number one gift your badge. Oh, sweet. All right. And also sends a road. Empathy landscaping just spent a road. Amped up shorty said Penn. Excellent. Penn, great program, great dental school. It's Dr. Mark Wolf that is the dean of that dental school. He used to be at NYU. I actually shadowed him in his clinic when I was an undergrad student, believe it or not. Yeah, how about that, right? Official Sports Talk TV, what's up, friends? Brendan, my guy, how you been? Who you taking, Prime Iverson or Prime Wade? Prime Iverson. Iverson would eat up Dwayne Wade. Dwayne Wade is a bigger athlete. Dwayne Wade's a bigger player, so that probably would give Iverson some issues. But so one-on-one, I would probably have to go with Dwayne Wade. But in any other situation ever, and even on that, the crossover that Iverson had, I think Wade was good. Iverson was quicker. Offensively, I would go with Iverson, although one-on-one, like I said, Iverson would have a tough time with Wade because he's a bigger ball player. Yusef, why OMFS specialists not in all hospitals? That's a great question. I don't know. Did you know that a lot of hospitals aren't paying some specialists to take call in the hospital? Did you know that? A lot of specialists don't get paid unless you go to the OR. And now that's almost like giving incentive to bring everyone to the OR. Not everyone, literally, but, weird stuff's going on, man. And you don't find this out until you're in it. Amped up shorty. He's in med school now. Enjoy your content and see what residency looks like further down the road. Yeah, awesome. And thank you. Good luck to him in med school. I'm sure he's crushing. I'm sure he's doing great. But UPenn, I'm not sure if you're allowed to moonlight. If you can moonlight, that's something to do. Otherwise, working on side projects. It's always about thinking a couple years ahead and setting yourself up for success down the road. All right. And let him know I said good luck to him in his second year of residency over there in med school. Brian Leclerc, is Dr. Glickman still around? As far as I know, he is still around. And that's as far as I will say. Dr. Glickman is still the NYU department head of oral maxillofacial surgery. Lathe DMD. Medics don't like calling us doctors. Yeah, Okay. Sam Stacks. Hey, Doc. What's up, Sam Stacks? What's going on? Tana Belly 20202. Do you struggle transitioning from undergrad to dental school? You know what one of my issues was that I didn't figure out how great Quizlet was for me as a learner. I learned so well in Quizlet. I bought the premium version. It was $20 a year when I bought it. I mean, this is going back 7-8 years. But those repetitions, the flashcards on Quizlet were by far the best. And then they put that AI thing where you could plug in like a PowerPoint or I forget what it was, and then it would make the Quizlet for you. Obviously, it needed a lot of edits. I haven't used it like that in 2 or 3 years. But yeah, Quizlet was excellent. And that was probably the biggest struggle because the most I took in undergrad was 21 credits. But dental school is roughly 32 credits a semester, believe it or not. Yeah, 32 credits a semester. It's a lot. Tonabelli. It's a funny name, but I like it. Funny in a good way. It's very catchy. You'll remember it. But yeah. So Quizlet was probably the biggest thing, by far the biggest thing for me, honestly, as far as studying goes. So transitioning to 32 credits a semester was a lot, and then they add on clinic, and then if you're going to oral surgery, you got to add on studying for that CBSE around the rest of the day. So yeah, it was a transition, but you make it through. You get through it. I got to the oral surgery program I wanted to get to, and here we are, trying to give some advice to other people interested in healthcare, dentistry, oral surgery, whatever it may be. I want to be able to be sure that I can make myself available to help. Luke, Pre-Dental, what's up, Luke? Yeah. I just did a TikTok Live 27 the other day. Good to see you here, Luke, my dude. And this is TikTok Live number 28. I'm trying to get back on these and do these a little more. All right. I figured out I could utilize ChatGPT to help me shorten my little analysis. I make a document of the timestamps and topics. So now I just use ChatGPT to do that, and that saves me like 30 to 60 minutes. Why? I don't know why it took me so long to figure it out, but yeah, now that frees up 30 to 60 minutes. I get to make more time, a little more sit down time. You know what I'm saying? And again, everyone that's on that didn't hear me say this in the beginning, the top 3 listeners on the podcast episode, it shows me at the end. I put you guys first in that caption on the podcast, Spotify and YouTube, just Dr. Gallagher's podcast if you want to listen. But top 3 listeners I put in the caption. So if that's you're going to be on there, by the way. I'm going to give you a little shout out like that. Johnny, any tips for managing patients with lingual nerve anesthesia after third mole extraction? Well, if it's within, say, now this is not medical advice. This is solely opinion. Don't take this as medical recommendation. This is social media. You can't do that. You could give corticosteroids if it's within a short period of time, like under a month. It might be worth putting them on a course of corticosteroids, like the 6, 5, 4, 3, 2, 1 dose pack of that. That's a Medrol dose pack. After that, within 3 months, and it still persists, like 0 out of 10, completely out, and the other side is 10 out of 10. Yeah, that lingual nerve, or even the V3 division, that will definitely be at that point. After 2 to 4 weeks, I would definitely send them to a specialist who does work with nerve repair. Whether that be a cadaver nerve or they're going to need an MRI. I would send them to that specialist as soon as possible. It's going to be an oral surgeon, right? That's something to consider. But I would probably send them to that oral surgeon that does nerve injury repair right away. But also probably something to think about. This is a great example of why wisdom teeth, probably a good idea to send them to a specialist, to an oral surgeon, to have those wisdom teeth removed. There's just so many complications that can happen. You do not want that happening to you, especially when there's a specialist out there that can prevent that from happening. You know what I'm saying? And in the court of law, it's not going to look very good. And it's very hard to defend someone who knows better. So that being said, let's continue. Luke, Pre-Dental, how's the chief year going? It's good so far. I got no upper level residents on my ass anymore, which is incredibly more comfortable. It's much better. It's great to not have them up my butt anymore. But no, it's going well so far. I'm on the lighter rotation. I have it for 1 more week, and then I start to get into the busy rotation. So September, October, November, December, those 4 months, it's 2 months and then 2 months, with the second one being the busiest rotation at the public hospital. Next one's at the private hospital. Right now I'm at the dental school. Sedations, not much call. Just call 1 week in a month. It's been great. And then the next 2 cycles, it'll be next 2 months, it'll be called 1 week in a month, but on call every weeknight, on second call every weeknight. So it's going to be a bit busier, therefore, right? Lathe DMD, favorite medical school show? I love The Good Doctor in New Amsterdam. I can't stand watching any doctor shows. I don't like Scrubs. I didn't like New Amsterdam. I'm trying to get when I'm not in the hospital, I'm trying to get my head and the escapism out of the hospital. I don't want anything. I don't want to be thinking about anything. I don't want to hear the pager goes off. If I hear even the wrong beeping, it's like, it reminds me of all those nights, every third night, especially my first year. Every third night, it'd be 1, 2, 3 a.m. Beep, beep, beep. Got to go in because it was Q3 call. My first 6, or my latter 6 months, and then even going into the off-service rotations. Yeah, it was, and that beep is just so traumatic. I'm not gonna lie, right? I'm not trying to sound like a wimp or whatever, but it's just not pleasant. And when you're hearing that, when you're in the middle of a dream, yeah, not great. Not great. I don't have any favorite medical shows lately. Sam Stacks, do you have mentees? Yeah, I do. I do have mentees. I just signed last Wednesday into a practice. I'll be working there starting the 15th of August next year. So 1 year from now, I'll be starting working out in Melville on Long Island. Lots of fun there. And I really envision It's a multi-practice that'll be starting at as an associate for 2 years and hopefully buying into that structure and figuring out a way to help build it even bigger, and bring a lot of value to that. That's my plan. That's my goal. And so that will be good. Mentees, I really want to see that owner of that multi-practice be my mentee, be my mentor. And I just talked to my mentor last week, and he was so disappointed that I signed with him because he wanted me to sign with his DSO. And I don't know what to say. I need to give private practice a shot before I'm ready to pack in, if you will, and go into DSO, because I think that's essentially what it is at that point, right? Lathe DMD. Yes, I love Quizlet. Dude, Quizlet is awesome. Yusef here in Egypt, OMFS takes 5 years to be OMFS surgeon without MD degree. Yeah, but you guys skip high school. Not high school. You guys skip college. You guys go right to maxillofacial right after high school. Is that correct, Yusef? That's what someone told me. I'm not sure if that. I thought that was you. I know it's that way in certain countries. Brian Leclerc, what's your go-to local for difficult to numb situations? Yep. I mean, I usually get it with Lido on that very rare once in a blue moon, like once every three months situation. Yeah, I'll give some local infiltrations with septicine. Sure. Yep. Experiences. Sean Buford, experiences advising osteoporosis patients taking bisphosphonates that were interested in an overdenture. Well, you got to see how long were they taking bisphosphonates? Was it IV bisphosphonates, or are they taking a pill? Are they taking an injection? It really depends on the type of bisphosphonate. It depends on how long they've been taking it for. Over 3 or over 5 years. That's when they're, and if it's IV, that's when you're really getting into the territory of you have a much higher percentage of getting osteomyelitis or osteonecrosis of that mandible, right? So you got to see, you said oral implants in general, you got to really see where that patient is in terms of, on that scale, right? Tonabelli 20202, did you have dental assisting experience when applying to dental school? I did. I worked for an oral surgeon in my gap year. That was about a year. And I shadowed general dentistry, cosmetic dentistry, and oral surgery, of course. Victor Razi, what's up? Brennan, keep it smooth, bro. What's up, Victor Razi? We just did that podcast. This was a couple weeks ago now. Highly recommend you checking out Victor Razi's podcast. And we just did one. This was Dosa Dental. I remember by numbers. Dosa Dental 98, I think. Definitely wanted to check it out and check out these dudes, Victor and Saad. Lionel Lee, have you worked with podiatry residents? No, podiatry was in our hospital, but they're not anymore. I had to hold up their pager. It was the weirdest thing. I don't know. But they're no longer in a hospital, so I haven't worked with podiatry at all personally. I don't know how to pronounce that, but they asked, have you finished your residency? Nope, one more 9 to 10 months left of residency. Almost. Anta-pshori, when did you start looking for a job? How did you find the job market? Well, so here's actually something really important. I'll take a few minutes before I pack it up to answer. Remember, you have all these exams throughout your career. Say you're going to medical school, dental school, surgery, whatever it may be, law school, another big one. A lot of exams. The road of your education is so long. And you have to understand that, what are the big steps in that road? Obviously, big exams, admissions tests to get into dental school, to get into medical school, the MCAT, the DAT, and then the next step. So, for example, for me, the CBSE to get into oral surgery, big exams. But even with that CBSE exam, however good you do and stuff, because everyone starts studying for that so early, right? And that's a good thing to do. I recommend, this is what I'm getting to. The most important thing you could do, whether it is medical school, dental school, law school, veterinary school, is that job. Because that job, when you get there, that's the thing that's going to potentially be 30, give or take, years, right? What's the longest amount of school you're going to go to? Well, the oral surgery program, if you're going for your 6th year, the MD, Anta-pshori, which your boyfriend is in, that's 6 years. That is a long time, but that's not 30 years. So when you're studying, this is how I try to tell my co-residents and colleagues, I'm like, you're studying for that CBSE test for on and off for a couple of years, right? I would recommend at minimum starting to look a couple years out just to see, not to look for a job necessarily. It's early, but it's a very good idea to figure out what is out there. I found out that in Wisconsin, they have hospitals that are entirely owned by the surgeons that work at the hospital. Interesting. I didn't know that existed. Then you start to understand that in these very convoluted areas, very very populated areas, Northeast, the West Coast, there's a lot of corporate jobs going on. There's a lot of DSOs buying up all those practices, right, in dentistry. And is that what you want to go into? Well, you got to get into an office and figure out what that lifestyle would be like. You're just going to go in, you're going to go home, and you're going to take call for a nearby hospital, get your hospital privileges in, and you're not going to have any stake in that practice. And they will try and sell you on that equity. Yeah, but when the equity is you get shares in the overall organization. Those organization is going to buy other practices, and they're going to sell other practices, and that's going to dilute or contract the amount of shares that you have with your equity that they give you. And you have to understand that That's going to fluctuate significantly over the years. You might, whatever you start with is not going to be what you end with. It might be more, it might be less. You have less, and you have no control over how much that's going to be. You see what I'm saying? So that's not something I'm interested in. I want to be able to be a part of the team and the environment and not just work for someone else. You're an employee. Another thing is, when you own the practice, you're going to be able to run money through the practice because you spent it on the practice, right? When you're an employee of that practice, more than 50% of your paycheck is being taxed. So you're losing a significant chunk of money. These are all things you gotta look into and think about when you're looking for a job. So to answer your question, I started at the end of my second year. I wasn't even halfway through my 4-year residency before I started to get an idea of what's out there. I talked with over 15 practices, owners, employees, this and that, maybe close to 20 in the last year since I started, year and a half since I started looking. And it took me about 9 months to really find two positions that I was interested in. One that was a DSO, and my intuition, my gut feeling was like, I can't do this. I need to try out private practice. I want to have some autonomy, some serious autonomy on a ownership, a partnership level that a DSO couldn't afford, couldn't offer, right? So that's my answer to you. And I hope that really makes sense, because I want to see everyone end up in the right situation that they're looking for. And maybe going in 9 to 5 and you're out is good, right? And that is fine. But you need to be able to find the right opportunity that allows you to do that. Do you have to take call? Do you have to work weekends with that job? You bought a house, you have a kid on the way in 3 months, you have to take the board exam, and you're working on Saturdays, you're taking call, and you got to go in once a month at 1:30 in the morning with a newborn at home. I'm not making this up. Like, I know people with these situations going on right now, or did have this going on 6 months ago. Yeah, things to think about. There's a lot of food for thought here, right? And unfortunately, we're not taught this on the come up, right? Lathe DMD, I'm going to head in a couple minutes. I want to specialize in OMFS because I love working with blood and have the adrenaline rush. But where's the but? I'm losing it. I don't see it. But Lathe DMD, do you think I will change my mind once I reach that goal? You know, it's funny because sometimes goals are very anticlimactic, and then you have to kind of figure out what your achievement or like your reward for your it's always internal. It's always an internal battle, like the man versus mind. Always very important to make sure you set your own goals for yourself. Don't let other people set goals for you. You need to set your own goals for yourself, and you need to be realistic with those goals that you're being set. Don't set a number. Don't set a salary. I would not advise with that mentality. I would advise more of, honestly, personally, my goal is by 40, I want to be having at least 3 to 4 days. By 40, my goal is to have at least like 4 or 5 day weekends. And I'm not saying I'm not going to work. I'm going to say I'd rather start that transition from working in person to more remote, right? More administrative. I got big plans, and I want to make an office culture, a practice culture that's better for everyone. And I don't know, it's going to take a lot of administrative work to get there. A lot of social media, branding, whatnot. No, for sure, you have to get your DDS and then get into OMFS residency in Egypt. Yeah, but your DDS is dental school. It's right. And then you do OMFS. What I'm saying is we have to do college and then dental school. Dental school is not college for us. That's graduate education. So we have 4 years of college that you skip right over when you go into dental school. You see what I'm saying? Something to consider. Lathe.dmd, do you think I will change my mind? I answered that right. Glenn Roy, how would you vet a surgeon if you needed Lefort 1 impaction plus BSSO? Know if you have a good one. Glenn Roy, I'm sorry, I'm not understanding the question there. Zane, what dental school did you go to? I went to Stony Brook Dental School, Long Island, New York. Yusef, are you trained to treat salivary gland neoplasia? We are, but that might require further training, like a fellowship in those areas, because neoplasias, you're getting into the cancer areas. So that would require, big resections. You might need to do, a neck dissection and such. Yeah, if I was a lawyer, it's best that they did at least a 2-year fellowship in head and neck, right? Alex Ram 0, did you do 4 or 6 year track? I'm in the 4-year track. I'm in my last year of the 4-year track. Luke, predental, what is the testing like once you start the 4-year OMFS residency? Well, we take the on-site. It's a resident board-like exam. It gives the program director an idea of how your academic learning is going compared to other residents in the country. And then the board exam you can take in your last year for the first part, the written boards, and then the verbal is within your first year after graduating. Tanabelli, what type of advice would you give someone going to dental school soon? Enjoy your time now. I would enjoy the summer. Okay. All right, friends. I got to pack up. Thanks for coming on. We'll talk soon. Guys, the 3 listeners that stayed on the longest, it'll show me who you are, and then I'm going to put you guys in the caption. All right, friends. Thanks for coming on. This is TikTok Live number 28. We'll talk soon. I'm wishing everyone a great week ahead. All right. Good night.